So good afternoon, everybody, and welcome to our session here on behalf of the Centre for Implementation Research. And I want to thank the organisers of Research Week for inviting us to have this session during the week, and welcome to everybody. My name is Alice Coffey. I'm Professor of Nursing in the Department of Nursing and Midwifery. I'm also the co-lead of the Centre for Implementation with my colleague here, Professor Sean Redmond. Today we have a presentation from a colleague in the UK. Her name is Jane Lewis, and she's the Managing Director of the Centre for Evidence Implementation in the UK. I'll just give you a little bit of information about Jane before we start. And Jane is here online through Teams. Unfortunately, she couldn't be here in person, but she will be happy to take a question or two from the audience, which I will repeat to her at the end. So Jane, as I said, is Managing Director at the Centre for Evidence and Implementation, responsible for CEI's work in the UK. It's an evidence intermediary specialising in the application of implementation science to improve the lives and well-being of people in communities facing adversity. So CEI's work encompasses evidence synthesis, impact and implementation evaluation, and active implementation support. Jane worked in social research and policy evaluation for many years, and then ran a network supporting evidence-informed practice in children's services before finding her way, by frustration, she says, at the limited impact of evidence into the world of implementation science. Before joining CEI, she was responsible for innovation, development and implementation and scale-up of Save the Children's UK early childhood programmes. Her current work spans systematic reviews, hybrid intervention implementation evaluations, programme development and advising on scale-up potential and strategies. I really want to welcome Jane and thank you for being here. And her presentation, she will begin immediately on implementation science in practice. Thank you.
Thank you, Alice, very much indeed for that lovely introduction and for inviting me to speak today. I'm so sorry I wasn't able to join you in person due to a freak and short-lived medical hiccup on my way across yesterday, but I hope to be able to come back to the beautiful University of Limerick campus at some time soon. So thank you for inviting me to talk today. What I want to do is, first of all, just say a little bit about the Centre for Evidence and Implementation, and then to say a bit about what implementation and implementation science actually are and why they matter so much. I want to introduce you to a couple of the key frameworks used in implementation science, and then I want to walk you through an example of a recent project that we've done which uses implementation science. And my aim really is to convey the excitement and the magic of implementation and implementation science, and to really whet your appetite for it, and to really reinforce what a fantastic resource you have at the university in the Centre for Implementation and the work that Sean and Alice and colleagues are carrying out. So my main aim is to really invigorate you about what implementation and implementation science are. Let's see how we go. So first of all, to say a little bit about CEI. We're all about improving the lives of people facing adversity, and we happen to think that the best way of doing that is to make the best use of the best evidence to improve policies and practices that serve those people. We believe that you can solve pressing social problems, but you need to use good evidence to do it, and that will only work if implementation is sound as well. We're lucky enough at CEI to work globally, so we're headquartered in Australia. We have a team in Singapore and in Norway, as well as a team based in the UK in London, and we partner widely across the world. So we have the terrific privilege of seeing implementation play out in very different systems and settings around the world. And, you know, our mission really is to spread the word and spread the passion about implementation, which is why we're so excited about the University of Limerick's work in this area. So what is implementation? What's implementation science, and why do they matter? Implementation is really just exactly what it sounds like. It's a specified set of activities which are designed to put into practice an activity or a program of known dimensions. So it's about turning something into practice on the ground, and that something needs to be something of known dimension. So a program, an intervention, an innovation, not just a kind of idea, but something specific. And what we know about implementation is that it requires a specified set of activities, focused, active, purposeful activity. It's about moving from letting it happen, doing nothing but just hoping that people will take it up, to helping it happen, disseminating learning, sharing ideas, to actually actively making it happen. And it's that active work that implementation is all about. And implementation science is basically the study of that. So it's the scientific study of methods to promote the systematic uptake of research findings and other evidence-based practices into routine practice, and hence to improve the quality and effectiveness of health services. So it's the study of how you go about doing that. And that might involve studying implementation on its own, in its own right. It might involve testing implementation strategies against each other to see which ones work most effectively. Or it might involve studying implementation alongside studying the effectiveness of an intervention. And what we know about implementation is that when we get it right, it really strongly influences outcomes. And we've seen this play out over and over again in a number of systematic reviews. So just to give you a couple of examples, Dulac and Dupree, their study, which was a review of 500 different implementation studies across different policy areas, they found that the level of implementation achieved is an important determinant of programme outcomes. Achieving good implementation not only increases the chances of programme success in statistical terms, but also can lead to much stronger benefits for participants. And what they actually found was that the mean effect sizes of interventions were at least 2 to 3 times higher when programmes were implemented well, 2 to 3 times more social impact. Doesn't that sound great? That is what implementation and implementation science is all about. And then a second review by Mark Lipsey in the States that was based on a meta-analysis of over 350 studies of juvenile justice interventions found that a well-implemented intervention of an inherently less efficacious type can outperform a more efficacious one that's poorly implemented. In other words, if you take something that hasn't worked anywhere else, but you implement it really well, you'll get better impacts than if you take something that's been shown to work everywhere else, but you do a poor job of implementing it. That's how powerful the implementation effect is. I don't think the good Dr. Lipsey is suggesting that we should go around finding the poor stuff and implement it well. I think his point is let's get the cracking good stuff and let's do a cracking good job of implementing that. And this is so important because in any area of social services that you care to look at, what we see over and over again is that widespread sustained implementation has been really difficult to achieve. So there is this massive gap between what we know works and what's actually being done in frontline services. And you see that in health, where the gap has been measured as 17 years from something being proven to making it into routine care. So you see it in health, you see it in mental health, in juvenile justice, in parenting support, in early learning. Very few children and families and communities actually experience what we know is the most effective. And when that happens, what happens is that the new and effective stuff generally reaches the more advantaged members of a community and not the more disadvantaged. And so getting implementation right is an absolutely profound equity issue as well. And we also know that poor implementation is depleting for everybody. You probably have your own experiences. Maybe you've led them, maybe you've been at the receiving end of somebody else's leadership of them when something wasn't implemented well. And you've seen it sap morale and confidence, take time out of the system, take money out of the system, and particularly do a disservice to the communities that we're trying to to work with. So we need to study implementation, we need to test implementation, we need to get really good at implementation. And I want to show you a couple of frameworks from implementation science that help in doing that. But before getting into the details of it, I just want to say that what I often say to people when I'm really kind of introducing implementation science to them is that much of what they will hear will be very, very familiar. What implementation science often does is name and frame things that will be very, very resonant, very much experienced by thoughtful researchers, thoughtful evaluators, thoughtful practitioners, thoughtful policymakers, thoughtful advisors to government. And I think that naming and framing is a very important thing that many sciences do. But I'm sure that much of what you'll hear me say will resonate with your own experiences and with the barriers and challenges that you've come across yourself in your own work. But I hope you'll find the way that implementation science frames this as being helpful. So I'll show you a couple of frameworks. Implementation science is really big on frameworks. There are lots and lots of theories and models and frameworks that are empirically supported, that draw on evidence about what effective implementation takes. One of the things that implementation science specialises in is not only producing frameworks, but also doing systematic reviews doing reviews to see how many frameworks we've got. And the one I most recently saw pointed to 153 different frameworks. There are so many that there's a very good paper by Per Nielsen in 2019, which was about kind of how to make sense of frameworks, how to pick the right framework. And he talks about there being different types of frameworks. So some of them are determinants frameworks, which I'll show you a couple of examples of, which highlight the barriers and facilitators to effective implementation and draw those together in very compelling and very helpful ways. Some of them are process frameworks, which set out the range of strategies that might be helpful in implementation and support choices about which strategy to use when. Some of them are evaluation frameworks that are framed around what to evaluate when you're looking at implementation. And then some are classic theories and implementation theories, which might be theories about organizational change or theories about behavior change, but that are employed in helping to make sense of what works in implementation. So what I want to do is walk you through a couple of examples of determinant frameworks, because they're a really good place to start, and then move on and talk through an example study where we drilled down and looked at implementation. So the first framework I want to show, and some of you might, if you're working in implementation, then you're highly likely to have come across this and to be using it already, is the Consolidated Framework for Implementation Research, developed by Laura Dam-Schroeder and her colleagues. And then in 2022, they published a revamped version of it. And this is based on reviews of many studies of what's worked in implementation, and also on expert engagement. And what they've done is to map out the different types of barriers and facilitators, or the drivers or determinants of good implementation that exist in different domains. So they talk about 5 different domains, starting with the lilac coloured one, the innovation domain. So features of the innovation itself that might act as barriers or enablers of implementation. So how complex the innovation is, simpler being much, much easier to implement and to sustain. The source, does it come from a credible source, a source that people being asked to implement it will regard as credible? Is it low cost? Does the innovation have an obvious relative advantage over what's already out there or what's already in practice? And is it adaptable? We know that adaptability is an absolutely fundamentally important aspect of innovation. Second is the individual's domain, and that might be the leaders of implementation, the folks actually involved in a hands-on way in implementation, or the communities that are being served by what's being implemented. And there, the kind of key enablers are the extent to which they have needs which will be addressed by this particular innovation, whether the practitioners involved have the competence, the knowledge, the skills, whether they have the opportunity and the scope and the actual power to implement what they're trying to implement. We all know how hard change within organisations is, and whether they're motivated and are really committed to giving it their best shot. And of course, that plays into the innovation, and particularly things like the source of it, and whether it's readily seen as being better than what's already out there. Then the third set of barriers and enablers are in the grey segment, the inner setting domain, and those are the features of the organisation that's doing the implementation that can either enable and support and be repurposed in support of implementation, or that can run across it and cut across it and undermine it. So the structures in the setting, the physical structures, the rooms, the IT equipment, or the issues like the workflow, the culture of the organisation, whether it's a culture that's supportive of evidence-informed practice, that's driving for excellence, that's supportive of change, whether there is actually attention for change, and whether this new thing is seen as an organisational priority or not. The question of compatibility, incredibly important. How compatible is the innovation with the inner setting? It may be a great inner setting and a great innovation, but the two just don't connect, they don't align. And what are the incentives and the resources that are available? Then the dark purple setting is the outer setting domain. So all the stuff that's going on in the world around the organisation that's implementing. So local attitudes and conditions, the funding streams, what's happening in policy, what's happening in regulation, in inspection and so on, and what the external pressures for change are. And of course, those can be supportive of change, or they can undermine the implementation effort. And then finally, the last domain is the implementation process domain, the dark green segment there, which is about the efforts that are being made to go about implementation and the extent to which those enable and support or cut across implementation. So developing implementation teams, assessing needs, assessing the context and looking at those alignment and fit issues, planning and tailoring the intervention, the innovation to fit the setting better, reflecting, evaluating, checking in with everybody about how things are going. So that is an incredibly valuable set of determinants or drivers or enablers or barriers to implementation. Where these things act as barriers, they can all be overcome or circumvented, but you need to know about them, you need to assess them, you need to analyse them, and you need to plan activities to get around them. And where they're potential enablers, you need to plan strategies that will actively employ them, bring them in force of, in support of implementation. And then just quickly to show you a second determinants framework. This is the EPIS framework developed by Greg Ahrens and colleagues back in 2011. And then there's an excellent systematic review of its use by Moulin and colleagues published in 2019. And the EPIS framework similarly talks about the inner context, so the green column of factors, and the outer context, so the blue column of factors. But it also talks about the bridging factors that come in between. And those are both innovation factors, so issues to do with the fit of the innovation and with the existence of people and organisation. And then also the bridging factors, which are to do with the existence of people and organisations that can actually support the innovation, the implementation effort, and that can bring the inner and outer context and the intervention all into alignment with each other. And the arrows surrounding these things really indicate the importance of that dynamic interplay between the inner context, the outer context, the innovation itself, and those bridging factors, and the importance of constantly looking at alignment, because all of these things are changing. The outer context is changing, the inner context is changing, The innovation itself will be being changed and adapted. And there's a constant kind of dance of alignment between those things. The other thing to highlight about this framework and where it takes its name from is the blue words around the outside: exploration, preparation, implementation, and sustainment. And those are a really important feature of this framework because those are the phases of implementation. There are many different ways of constructing the phases, but this is a really, really neat one. So it emphasizes the importance of the exploration stage when an organization, a setting actually thinks about what are our problems, our challenges here, what is it that we need to address, what's its priority, what's top priority, what are the possible solutions, and what might be the best way to address that problem. And let's look at what's available out there and let's assess the fit of those things with our setting and make a really careful, measured decision about what it is that we actually want to implement. And then there's the preparation phase, which is about planning, setting up an implementation team, preparing the infrastructure, preparing the setting, preparing the staff, preparing the service user groups to be ready for it. And only then does implementation actually start. So that's the process when you start delivering the new thing. It all feels pretty awful, no matter how carefully you've chosen and prepared for it. It feels clunky. You miss the stuff that you were doing before. And it's a process of sticking with it, refining, evaluating, monitoring, and improving implementation as you go. And then finally, the phase of sustainment, when you make sure that you've got drivers and enablers in place that can keep this going. So a really important thing to highlight about these phases is that 2 out of the 4, half of them come into play before implementation. And that is such an important message about implementation. And what often happens is that people reach too quickly for the new thing, start implementing it straight away, and they've skipped those first 2 stages, and then things fall apart. So what we know is that you don't get to skip a stage. It's a question of pay now or pay later. You've got to do the exploration and the preparation. If you leap straight into implementation, you're going to only have to come out and go back into exploration and preparation. So do those stages and do them well. So that's a very quick introduction to a couple of frameworks. There are many of them out there. There is no magic about which is the right one. It's a question of which one fits with your project, your assumptions, your theoretical background that you're coming to your project with, and your research questions or implementation questions. But I'd really encourage you to explore them. And these two, the EPIS framework and the CIFA framework, are very good default places to start from. Okay, so that's all I will say for now about implementation. And I want, just in the last quarter of an hour or so, to talk through a project example which looked in more detail at implementation. And this is a project that was funded by and carried out with the Wales Centre for Public Policy, which is a What Works Centre in Wales. You might be aware of them and their work. They're absolutely great. And they work to support better policy in the Wales government and better implementation. And they've really got into implementation science and are doing some really nice work to bring it into their ways of working and the support that they provide. And the aim of this project was to look at what implementation savvy policy work actually involves. So how can policy work be cognizant of what's required for effective implementation, and how can it bring this thinking into the policy process? Because as Bob Hudson and his colleagues write, the policies don't succeed or fail on their own merits. So the quality of implementation is absolutely integral to policy success. And all the stuff from those 2 quotes that I showed you from Mark Lipsey and from Derlach and Dupree's work would apply just as much to policy implementation. The focus of the project was on big P policy, so policy that's legislated, mandated, regulated by government at national or federal or state or local level. And it might be implemented at any level. So it might be implemented in municipalities, in local authorities, in local settings, hospitals, schools, whatever. But it's big policy making that we were concerned with. Two particular features of the Wales context that are relevant here are, first of all, a view often expressed in Wales, so I feel I can quote it, that that Wales has good policies, but the implementation is often poor. And then secondly, Wales, as you'll probably be aware, has a devolved governance system, which means that it only has partial legislative responsibility within Wales, and many areas of policy are reserved to Westminster. And what that means is that Wales receives policies from Westminster and makes policies which might be so it receives policies from Westminster which might be poorly construed for the Wales context. And it makes policies which might be intentionally or unintentionally in tension with Westminster policy. So those features just kind of complexify the Wales policymaking landscape. So the approach that we used brought together two bodies of knowledge. The first is that we did a review of reviews. So we wanted to look across a wide range of policy areas, and we had quite limited study resources. So we couldn't do a systematic review in each of a number of areas. And instead we did a review of reviews, looking for existing reviews across a wide range of policy areas that commented on implementation. We selected 15 in all, following a systematic search. And then the second body of evidence that we used, which was to dig deeper into implementation, was recent guidance documents and toolkits, which recommended approaches for addressing implementation in policy making. And again, we searched them systematically and prioritised them and selected 10 overall. It was quite challenging to bring these two bodies of knowledge together because the reviews were good on identifying barriers and facilitators to implementation, but they didn't say very much about what the policy-making processes had been. And the resources were good in recommending approaches to policy making, but often without very much clarity about the barriers that they were intending to address or the facilitators that they were wanting to engage or to put into place. So challenging, but what we found, particularly by looking at the evidence through the lens of implementation and some of the frameworks for implementation, was two integrating concepts. And the first of those was ambiguity. So scholars of Richard Matland's work on policy implementation will know that ambiguity is an important concept. And it's also one that really aligns with important concepts in implementation science about the need for clarity about what is it that's being implemented and clarity about what the implementation processes are. So the reviews that we included frequently pointed to a lack of clarity about the innovation as being a real barrier to implementation and clarity as being a real aid to implementation where it exists. And that meant clarity about why, what's the problem, what's the need that's being addressed, what are the aims, what's the change that's intended, and how. So enough clarity and direction about implementation to avoid confusion about how the policy should be executed and who's responsible for what. And that direction might be quite high level, particularly if the policy needs to be carefully adapted to local contexts, or it might be very detailed, or it might be delegated to another body to oversee the implementation. But one way or another, there needs to be enough clarity about how the policy should be implemented for people to be able to take it forward. And then the second important integrating concept was alignment. A really recurrent theme in the reviews was that implementation was harder because the policy wasn't well aligned always aided because it was well aligned with those inner contexts and outer contexts that the frameworks that I mentioned really bang on about so helpfully and so importantly. And what policy needed to be aligned with encompassed the policy context itself. So the existing array of policies and regulations and so on. If a policy was poorly aligned with them, then competing priorities just play out and get resolved one way or another, not always in the way that policymakers intended. But if something is well aligned, then the existing infrastructure can be brought into play to support the implementation of the new policy. So existing policies support the new policy. And the new policy also needed to be aligned with the needs and priorities. So the reviews pointed over and over again to the importance of political backing, organisational priorities and goals, social norms and values, the interests of other stakeholder groups. And you'll have seen those reflected over and over again in the CIFA and EPIS frameworks. And it needed to be aligned with the implementation infrastructure. So with the resources that are available or can be made available to implementing organisations, and with the physical infrastructure, the structures, the organisational processes and systems in place. So you can see all the echoes between that thinking and the resonance with the frameworks, the EPIS and CIFA frameworks. So ambiguity and alignment as two really important integrating concepts. The organisations involved in implementation, so the schools, the hospitals, the police forces, whatever it was, all used a range of strategies to create or enhance clarity and alignment. That's basically what implementation support strategies are. But our focus was on the approaches that needed to be part of the toolkit of policymakers as part of their roles in policy making and policy execution, and the work that they needed to do to create that alignment and to reduce that ambiguity. And the policy resources that we drew on were particularly helpful here. And they highlighted 7 sets of approaches to policy work, which we identified as potentially helpful in reducing ambiguity or aligning, increasing alignment. And again, those are really consistent with the implementation science frameworks. And so coming to the study with that implementation science lens was really important. And those are the problem and context analysis. So understanding the problem and the causes, understanding the social, institutional and political contexts that the problem plays out in. Secondly, stakeholder engagement. So stakeholder engagement to identify solutions, to understand potential barriers to implementation, to garner support for the new policy. Thirdly, identifying the resources and the capabilities that would be available and that would be required for implementation, and understanding how to repurpose what's already in the system, or how to put these resources and capabilities in place if they don't exist. Then setting up effective approaches for governance and collaboration and coordination, setting up a framework for monitoring and evaluation, putting in place systems for leadership of implementation at multiple levels, to do that, to create that lack of ambiguity about who's going to be doing what and where. And then finally, the importance of communication and framing. So being able to convey the why and the what of the policy, helping that process of aligning it with needs and priorities and preferences. So those were the set of implementation support approaches that emerged from the study as being an important part of the panoply of the portfolio of tools, the toolkit for policymakers. 3 points are worth making here, finally. So first of all, the fact that these implementation support approaches, the 7 around the outside, can come into play at different stages in the policymaking process. So, for example, you might be doing stakeholder engagement early on in order to understand the problem. You might be doing it later to understand the challenges in implementation and to course correct. There are also suggestions in the data that these 7 implementation support approaches might actually be mutually reinforcing, so they add value to each other. So, for example, problem and context analysis at the beginning might inform the stakeholder engagement that you then go on to do and mean that you've planned it and done it better. Stakeholder engagement might actually aid your identification of the resources and the capabilities that are going to be needed for implementation, or it might help you to understand how best to communicate or frame the problem and the policy to get buy-in to it. And then finally, the evidence also suggests that there might be a compensatory dynamic going on here. So gaps in the early use of a particular implementation support approach could be compensated, at least to some extent, with its later use. Gaps in the use of one could be compensated for by the use of something else instead. So if there are gaps in the early use of stakeholder engagement, then doing lots of that stakeholder engagement later on might compensate, or establishing governance structures that actually engage the right people if you didn't do the right stakeholder engagement at the beginning, or communicating and framing the policy in a way that helps to garner support and helps to compensate for that lack of stakeholder engagement at the beginning. And this compensatory dynamic is particularly important because of the sort of political realities of policy making, which mean that things can't always be done in the right way, with the right people at the right time, and particularly important in a Wales devolved political context where policies might be sent through to the Wales context without some of that early work that should have been done. But that compensatory dynamic is really important and suggests that nevertheless, good policy implementation can be achieved by doing these things well later on. So that is where we got to in the study. Our synthesis pointed to savvy policy work involving building implementation thinking into policy logic and policy content right from the start, attending to ambiguity and the what, the why, and the how of policy, assessing alignment and working to improve and increase alignment all the way through, and drawing on implementation support approaches to ensure that the conditions and the infrastructure for effective implementation are built right from the beginning. So I hope that helped to illustrate what bringing an implementation lens to thinking about policy can bring, and the value of using those determinants frameworks at an early stage to sharpen analysis and thinking. And I hope that that's given you a flavour, a taste for implementation and for implementation science, and it's whetted your appetite and helped you to really appreciate the fantastic resource that you have here at the university in the Centre for Implementation and in the work of Alice and Sean and their colleagues. You have a terrific set of people here working in implementation, and you're very, very lucky, and I hope that this has helped you to see what terrific value they bring. Thank you very much indeed.
Thank you, Jane, very much. A message we've been, I suppose, articulating for a few years, and it is taking off. People are learning more about implementation, and we can see now that it is not just in practice or programs, but also in policy that it makes a difference. Can I just invite now a question or two from the audience? We have a few minutes for questions, and Justina will keep us to time. But I will, if you don't mind, repeat the question to Jane, because we haven't got the mechanism where she might be able to hear you from the audience. So if you have a question, if you don't mind me repeating it to Jane, that's okay. So, any questions? Yes, Catherine.
So I don't know whether
Yeah.
to speak to you.
You can speak to me so I can hear you.
So, I mean, it's really interesting that it takes 17 years on whole to get evidence into practice. Are there any figures on how long it takes policy to be implemented? I mean, given that, like, the timeline is really strict. That's part one. The second one is...
Can I ask that question first, maybe,
Oh, yeah,
Catherine?
okay. Might be yes or no.
Catherine is asking about, there is evidence to say that it takes 17 years. We know that from the health domain for evidence to be translated to practice. Are there any figures on, or have you any knowledge of figures on the amount of time it might take for policy evidence and policy to be translated into policy?
That's such an interesting question, Catherine. I don't think I've seen data on that. So how quickly it takes for something to be well demonstrated in evidence to actually make its way into policy. I mean, I suppose that 17-year gap is partly about how long it takes to make things into policy, because it's very often through policy that effective approaches will end up being brought into a system and embedded in a system. I mean, that process of the take-up of evidence happens in a number of different ways, doesn't it? Sometimes it might be about an innovator or a program developer getting their program out there to settings that are able to pick the program up and incorporate it with good implementation and good implementation support without the need for policy change. And sometimes it's about it's working in a setting where policy change is going to be a necessary part. I don't think I've seen evidence for how long it takes for evidence to embed in policy, and I think that it's a slow old journey for that as well, unfortunately, isn't it? The timelines for getting policy implemented are probably somewhat shorter because the policy will come with the imperative for implementation, but getting it implemented well in policy, getting policy implemented well in practice is the real conundrum and the thing that we know really takes time. So it's a very interesting question, and definitely different dynamics will be at play, Catherine. It's a very thoughtful and interesting question to ask.
Maybe a research question, Catherine. Yeah. The second part.
I have another question.
Yes.
Somebody else might want to ask a question first. And I don't want to take
we can take the second question if you wish.
Okay. So I love your new model and implementation support approaches. That's not published yet, is it?
Is your new model published yet, Jane?
Yes, it is. Yeah, I should have said that. Yeah, it is published on the Wales Centre for Public Policy website. I think if you just Google, well, if you go onto it and Google Centre Evidence Implementation, then I think it will come up. Reach out to me if you can't find it, but if you Google Wales Centre for Public Policy and then search for Centre Evidence Implementation, I think it will come up. Or it's called on their website. It's called something like "How to Ensure Your Policies Won't Fail" or "Why Your Policy Will Fail" or something like that. Very clearly a very direct challenge to policymakers. But yes, it is published.
And it was good that the policymakers were inviting you to work with them. That's what we're hoping for here. Is there another question from the audience? Yes.
Hi. In your study, did policies that underwent full public consultation, were they implemented any better or worse than policies that didn't?
I'm going to repeat, sorry, I hope it's right. In your study, were policies that were...
That underwent full public consultation?
That underwent full public consultation, were they implemented better?
There were so I don't think we had evidence that would allow us to say whether they were implemented better or not across the piece. We certainly had examples where public consultation was seen as something that had supported implementation and had meant that the public was, the policy was developed in a way that aligned better with the public and the service system. And avoided some obvious mistakes, and the buy-in was there. we also had examples where there had been public consultation or quite widespread stakeholder engagement, but where the policy nevertheless was not well aligned, or where there was ambiguity despite that in the policy, and it's how it sat with other existing policies, or ambiguity about what was intended, who was meant to do what. So, it can help. It ought to be able to help a lot, shouldn't it, if it's done well? But it's not necessarily a panacea, nor is it necessarily absolutely essential. I'm not arguing against public consultation, but, what that means is that if a policy is moved forward without that public consultation, there are nevertheless other implementation strategies that could be employed to help to make it work better despite that. As I say, I'm not arguing against public consultation. That must surely always be the first resort.
Thank you. Question at the back, and just one more question now, Jane. Thank you.
Hello, thank you very much for your presentation, Jane. My name is Anne McFarlane and I'm based here in the School of Medicine. And I just wanted to share a mention of another theory which is very relevant in implementation science that I've had the delight to be involved in, which is normalisation process theory, led by Professor Carl May in the UK. So for colleagues who may wish to have a look at that's proving helpful in the literature. And my question to Jane really was about whether in your review you came across any explicit use of participatory action research methodologies in policy implementation processes where that was explicitly used to frame the implementation work. Again, in some of the studies we've been doing, we've been finding an explicit pairing of theory with participatory methodologies really, really insightful.
So a question from Professor Anne McFarlane, who is from the School of Public Health, and she would like to introduce the normalisation process theory as well, which I'm sure you're aware of, Professor May. And she wanted to know, and I hope, Anne, I paraphrase you correctly, whether you found that participatory methodology actually, have you evidence that it improved the implementation process in any of your work?
Very interesting question, and thank you so much, Anne, for highlighting normalisation process theory. It's a really, really interesting, very well evidenced, very widely used theory, model, framework, approach to implementation, with a lot of really, really good thinking around, and it's been quite well developed. With some very, very helpful practical resources around it. I should have said that of EPIS and CIFA as well. These approaches all have, good solid websites and lots of resources supporting them. So thanks very much indeed for highlighting that one. I'd absolutely endorse that. I don't think that any of the reviews that we included had very much to say about participatory research, but again, that would be and participatory approaches to policy making. But again, the tenor, the general gist of the evidence would really point to those as being important policy making approaches to consider, important approaches to build into the policy making toolkit. And you could see a number of the barriers and facilitators that they might help to address, and a number of the implementation support approaches around the outside of our conceptual picture that those would really help and align with. So probably not direct explicit endorsement of them, but generally, from our study, a set of findings that would speak positively towards participatory approaches.
Thank you very much, Jane, and thanks again for your talk. I think we're on time now for the next presentation. So again, thank you from us for participating today, and we will find another time when you can actually be here in person. So thanks very much for your questions from the audience as well. Thank you.
Thank you so much, and thank you so much to everybody, and thank you to everybody for making the IT work so I could at least join you in this way.
Thank you for the support. Yes, thank you very much.
Thanks.
Bye, Jane. Thank you. So Sean and I are just going to, if you can get the presentation up for me. We have a lot of support needs today. It's much easier when people are here in person. So again, I suppose the title of our presentation today was The Journey to Becoming a Centre for Implementation here at UL. And I'm just going to, I suppose, share a few slides with you about the journey that we were on and are on currently. I suppose we began our journey with funding from the HRI, very grateful for that funding in 2019. And it was a research cluster fund, and that we were actually funded to develop, deliver and sustain research and expertise in implementation science. And at the time, I suppose nobody really knew what we were talking about. So I can absolutely say that. But now you heard from Jane how important it is in every realm, not just in health, but also in other disciplines too. It can relate so much so to policy particularly, and also then to when it translates into practice, how it's implemented is so important. So we started to grow a multidisciplinary research cluster because we actually saw the benefits of it not just being in the health area, but that it actually impacts on a lot of other areas as well as health, outside of health, in the environment, for example, or in the policy area in relation to business as well, and in other areas that we've been working with in justice as well. So we wanted to enhance and support implementation of evidence into research, policies and programs and practices, professional practices, to develop implementation research capabilities. So not just I suppose making people aware of the importance of implementation science, but in all of those areas, but helping people to learn how to use the methodologies, and making people aware of the many, many frameworks and theories that there are. And some theories mentioned today we've used a lot, but also there are many more that fit the actual area or research question, as Jane said. We also wanted to encourage the integration of implementation science methods in multiple disciplines, and work across faculties, across disciplines in UL. And you can see what Jane mentioned there, that it's important that implementation scientists are in there from the beginning. So at the design of the policy, at the design of the practice, at the design of the implementation of the innovation. So we were going to do this through research collaboration, networking and capacity building. So this over the last few years, the highlights I suppose I have here, we've had annual seminars with people mentioned earlier, Laura Dam-Schroeder, who developed the CFIR framework, with Carol May, mentioned from the normalization process theory, and Jeff Kern, who is a professor in Arkansas, who specialises, and if you read about implementation science, you will see a lot of his work, making it simple, really, the language of implementation science. And Jeff is an adjunct professor with us here in the university. We also emphasised the multidisciplinary nature of our work. So we have also worked in collaboration with the Centre for Effectiveness Services to deliver 2 6-week online sessions and training sessions on implementation science. We also had a summer school, and all this in creating awareness and capacity building with Professor Kern. And Professor Kern was also a Fulbright specialist, so we were awarded a Fulbright specialism for him to deliver the summer school in 2022. In all that time, we also networked widely, and we met Jane and colleagues like Jane across Europe and across the world, and to actually build our networks through conferences, not only speaking at conferences, but also holding conferences and hosting conferences here in UL. We had our own first Health Implementation Science Conference that ever was here in UL. We also co-hosted the UK-Ireland Implementation Science Conference in 2022 with King's College London. We also then collaborated we were originally called the Health Implementation Science and Technology Cluster, but we collaborated very closely with the Research for Evidence into Policy Programmes and Practice, which were using implementation science methods and action research methods already. And that collaboration has grown, and we worked together to actually formulate the Centre for Implementation. We visited the Centre for Implementation Research in Arkansas, and Sean's going to tell you about what we learned from that centre. And we also joined the European Implementation Collaborative, and one of our members, Jacqueline Dwan, is elected to the board in October 2023, so we're delighted with that. In relation to research, we supported early career researchers by seed funding a number of pilot projects that have come to fruition, have presented their work, have presented reports and results from their work, so that's fantastic. And we also were the recipients of a number of research awards that are highlighted here and are still ongoing from the HEA and from the HRB, etc. And I suppose the biggest highlight is the Research Impact Award, HEA Impact Award, which helped us to focus on being a centre for implementation research and particularly focused on policy implementation. So I'm going to hand you over to my colleague Sean now, who will take you to lessons we learned. Thanks, Sean.
Thanks. Do you want to stay there, Alice?
I'm sorry, I can stay here.
Thanks. So for anybody who doesn't know me, I'm an official in the Department of Justice, as well as having a kind of an academic interest in implementation. I also have a practical interest as well. As Alice was saying, the seeds of thinking about developing a centre within the university was sown long before I or my colleagues from REP became involved with the HIST cluster. So it started from a really good foundation, and we'd started to spec out what a centre might need, where the demand might be, and what kind of things we might need to sustain it. So, you know, one of the things, I'm not sure whether there's an implementation research to support this, but we used a common sense kind of logic, which was if you want to set a centre up, go and find the best person in the world to have a look at what they do. And Jeff Curran is one of the leading researchers, one of the leading thinkers in relation to implementation research. And so we went to visit him in Arkansas to look into his eyes and look in the eyes of the other staff in the centre there, and also to go with a kind of a doubting Thomas kind of audit as well, to see, you know, not only what people put out in terms of promotional information, but also where the creeks are as well, because it's the similarities and the differences that are important to us. So we conducted this for a due diligence exercise in the University of Arkansas Medical School Implementation Research Centre as a discrete department of its own. But it's also now an implementation is an established focus for study. So in all the federal programs for impact evaluation, there's a requirement for an implementation element to it. And there's a key difference there in relation to trying to grow that market in an Irish context as well. They developed considerable expertise in working across multiple disciplines. It was really, really interesting talking to people from health, from community-based services and other kind of mental health services about the common language that they used in relation to implementation study, and also their kind of their passion for it as well. They were working with state academic and philanthropic partnerships, and what we came away thinking was that there was a really good fit for ambition here between ourselves and the Implementation Research Centre in Arkansas, but also some some significant differences. And one of the differences that was significant to us is that whilst implementation science is an established part of research asks at federal grant level within the states, it's still a kind of a nascent and an emergent kind of area of study in Ireland. So when we came back and we were briefing the team we work for, what is now called the program implementation team, we said, look, based on different work that we've done, we think that there should be different elements to the centre that we were envisaging at the time. That the implementation needs to be policy program and community directed with intervention-focused research. We also, though, I think, because it is a nascent area of research, we needed some quick wins as well, or we need some quick wins. So in addition to the long-term research studies, we need to be able to turn around ways of processing problems that government departments might have and to turn those around reasonably quickly. But also then we need to look internally. So if our ideas around sustainability, it's not just about individual scholars developing their own academic careers. It's also about how do we build a sense of team and a sense of esprit de corps within the university to think about implementation. And so ideas like support with grant writing, and accredited skill development for UL staff. So we've used kind of thinking like, closed group theory to start thinking about how do we develop this team across disciplines to create a virtual team of people interested in implementation science. And the second to last bullet there talks about field building as well. So in recognition that this is a kind of nascent market, if you like, is that part of our energy within the new centre needs to go to developing upstream conversations with policymakers, decision makers about the importance of implementation research, and importantly, the importance of coming to UL to do it as well. The last bit that we noticed was that in Arkansas that we really felt was important as well is in addition to having a core staff team within the Implementation Research Centre, we needed a committed community of scholars. So this is an idea of, as I say, that we developed this sense of virtual team. So in addition to ideas around support with grant writing, we're also investing in training for researchers and supervisors and staff who are interested in implementation science at an introductory level, also at applied level as well. And also we're looking to try and develop a team which we call the kind of mastery level as well. And I think mastery is a kind of an interesting concept when we think about implementation science, because it is a kind of nascent science. As Jane was saying, that there are, 150 tools and frameworks. And if you're anything like me in terms of DIY, if you open the toolbox and nearly cry because there's so many tools in there, what we need is people who develop good craft skills around thinking about implementation research, as well as having the technical ability as well. So, Alice, over to you.
Thank you, Sean. So, as Sean said, we learned many lessons, and I suppose we progressed our thinking around the centre. So from past to present, we're happy to say that we've just recently been designated a Centre for Implementation by the university, and we've got HEA funding for 3 years to actually do this work. Related to policy, of course, we've got a good team of people, multidisciplinary team, programme monitoring team working with us. We're the first multidisciplinary implementation research centre in Ireland, cross-faculty representation, and we've started our processes already. As Sean said, we need to build capacity, so we're set up another training programme for introductory programme, intermediate or applied programme, and then we will have a mastery programme in the autumn. And we will continue to do that through accredited modules as well. We're currently recruiting a director, a research fellow and a senior administrator to the centre. And once we're up and running, we hope that we will have more news to tell you at a later stage, but we're very excited by the prospect of having the funding to do this, but also having the interest across the university, which is great. And that started from a small amount of cluster funding back 4 or 5 years ago. So we're very grateful for that. And thank you for your attention. I hope you learned today, again, a bit more about implementation science. And we hope that you will come to our training, that you will engage with us over the next number of years. And we will have a lot more research to disseminate to then. Thank you. Thanks for your time.